Are your legs and ankles swelling again? For many adults over 60, puffy ankles, tight shoes, and heavy legs become a daily struggle. Swelling can be your body's early signal that circulation and fluid balance need attention. When we listen early, we can often change the trajectory. If you ever notice swelling in just one leg, sudden chest pain, or shortness of breath, seek emergency care immediately. Those are red flag symptoms that need urgent evaluation. Today I will explain why swelling happens, what you can do about it, and a simple plan to start improving comfort and circulation step by step. Swelling is also called edema. It often shows up around the ankles because gravity pulls fluid downward. When blood and lymph do not flow back toward the heart efficiently, pressure builds up, and fluid seeps into nearby tissues. Ankles look puffy, skin can feel tight, legs feel heavy. Common contributors include long sitting, too little movement, vein valve weakness, lower calf muscle strength, and a slower lymphatic system with age. Swelling can be mild, or it can be a clue that your heart, kidneys, veins, or lymphatics need more support. Talk with your licensed clinician for diagnosis and personalized care. Your leg veins contain tiny one-way valves that help return blood upward. Your calf muscles act like a pump. Each step squeezes the veins and pushes blood back to the heart. If those valves weaken, or the calf muscles are not activating enough, blood can pool in the lower legs. Pressure goes up and fluid leaks out. Alongside veins, your lymphatic system moves excess fluid and cellular waste. With age, lymph movement can slow. When vein function, muscle pump, and lymph drainage struggle together, swelling becomes persistent. You are more likely to experience swelling if you live with diabetes, high blood pressure, kidney or heart conditions, varicose veins, or if you sit for long periods. Certain medications may also play a role. Always review your medication list with your clinician. Here is a piece many people overlook. Your nerves and blood vessels rely on thiamine, also known as vitamin B1, to function properly. Thiamine helps convert carbohydrates into usable energy. It supports nerve signaling and plays a role in vascular health. With age, digestion and absorption can change, and some medications may increase the body's demand for B1. Low B1 may be associated with fatigue, heavy legs, tingling or burning in the feet, and leg swelling for some people. In clinical contexts, improving B1 status has been associated with better comfort and function. Individual results vary. Many older adults notice changes within several weeks of consistent support, especially when B1 is paired with daily movement and smart hydration. Food sources include whole grains, beans, peas, nuts, and seeds. Cooking and lower stomach acid may reduce B1 availability from food for some people. This is why supplementation can be considered with professional guidance. A form of B1 called benfotiamine is fat-soluble. That means it may be more available for some people and may stay in the body longer than standard water-soluble thiamine. Early clinical research suggests benfotiamine may support healthy endothelial function, the inner lining of blood vessels. It may also support nerve comfort, both relevant to circulation and the calf muscle pump. It is not a cure. As part of a comprehensive plan, it may help reduce feelings of heaviness and support normal fluid balance. Common supplemental ranges used in research and practice are 150 to 300 milligrams per day, often divided with meals. Your needs may differ. Always consult your licensed clinician before starting any supplement, especially if you take medications for the heart, blood pressure, diabetes, or blood thinners. Several nutrients can work together with B1. Magnesium in the form of glycinate or citrate may help relax vessels, support nerve function, and reduce cramps. Food sources include spinach, almonds, pumpkin seeds, and avocado. Vitamin C supports collagen and capillary integrity. It may help maintain less leaky microvessels. Foods include citrus fruits, berries, and bell peppers. Supplemental ranges commonly span 250 to 1,000 milligrams per day if appropriate. Rutin is a flavonoid from buckwheat, apples, and asparagus that has been studied for vein comfort. CoQ10 supports cellular energy, especially in heart and muscle tissue. Many people use 100 to 200 milligrams per day if appropriate. Discuss all supplements with your clinician, especially if you use anticoagulants or medicines for the heart, kidneys, or diabetes. Supplements work best on top of strong daily habits. First, add movement breaks. Walk 10 minutes 3 times a day. If walking is hard, try seated ankle pumps and heel raises. Second, elevate your legs above heart level for about 20 minutes, 2 or 3 times daily. Third, consider daytime compression socks at 15 to 20 millimeters of mercury to reduce pooling. Do not wear compression socks to bed. If you have peripheral arterial disease, check with your clinician first. Fourth, hydrate steadily and limit heavy fluids late at night. Balance electrolytes if your clinician approves. Fifth, Support lymph flow with gentle dry brushing toward the heart, light upward massage, or pool walking. Sixth, clean up the diet by reducing ultra-processed salty foods and emphasizing fruits, vegetables, beans, whole grains, and high-fiber meals. Seventh, support posture and sleep. Left side sleeping may aid venous return. Avoid crossing your legs. Shift position every 30 to 60 minutes. Let's turn knowledge into action with a simple 5-day starter plan. Take photos or measure ankle circumference at the same times each day to track progress. Day 1, awareness and reset. In the morning and evening, check your ankles for puffiness, sock marks, and heaviness on a 1 to 10 scale. Focus meals on whole foods. Reduce canned soups, deli meats, and packaged snacks. Walk 10 minutes after lunch and dinner. In the evening, elevate your legs for 20 minutes and breathe deeply. Day 2, gentle flow. Add seated ankle rolls. Make 10 circles each direction for each leg, 3 sets per day. Start dry brushing before your shower with light strokes toward the heart. Add magnesium-rich foods. Hydrate steadily and avoid sugary drinks. Day 3, activate B1. With your clinician's approval, start benfotiamine at 150 to 300 milligrams per day with meals. Add vitamin C from food or a 250 to 500 milligram supplement if appropriate. Insert 10 minutes of easy movement after breakfast. Recheck your ankles at night and compare with day 1. Day 4, power combo. Continue benfotiamine. Consider routine from food or a supplement and CoQ10 if appropriate. Build colorful anti-inflammatory plates with greens, reds, oranges, and purples. Soak your feet or legs in warm Epsom salt water for 15 to 20 minutes if approved. Use daytime compression socks at 15 to 20 millimeters of mercury if swelling persists. Do not wear compression socks to sleep. Day 5, check, adjust, and continue. Compare your notes and photos from day 1. Identify what helped most, such as elevation, walking, benfotiamine, or compression. Keep 2 or 3 habits daily for the next 2 weeks. If swelling worsens or new symptoms appear, contact your clinician. Some people notice lighter legs, fewer sock marks, or more comfortable shoes within 1 to 2 weeks. Everyone is different. The goal is steady progress and safer circulation habits you can maintain. Healing is rarely instant, but small consistent steps add up. Keep walking and elevating. Hydrate wisely. If your clinician approves, continue benfotiamine and supportive nutrients that fit your situation. Reassess weekly with photos, measurements, and your heaviness score. Remember, one leg swelling, chest pain, or new shortness of breath require urgent care. Your safety comes first. Your body wants to move fluid the right way. Give it what it needs: gentle motion, smart nutrition, and targeted support. If this episode helped, please like the video, share it with someone who needs it, and subscribe for weekly science-based guidance you can use right away. In the comments, tell us your age and which habit helped your legs the most: walking, elevation, magnesium, benfotiamine, or something else. Your story could help someone today. This content is for educational purposes only and is not medical advice. Always consult your licensed clinician before starting supplements or changing your medications, diet, or exercise. Seek emergency care for one leg swelling, chest pain, or shortness of breath. Thank you so much for watching. I truly appreciate you. Can I ask you something? How young are you, and what are you doing right now to stay strong and independent? Walking, eating more protein, stretching, lifting light weights, gardening? Please share below. Your answer could help someone else in this community who is trying not to lose their strength.